Okay, fantastic. So, hi everyone, and welcome to our tour stop in New Jersey for our Veteran Oral Health Road Tour. And as we noted, today's session is being recorded, and we do have a few introductory slides to go through as we start our session today. Thank you all for being here. Our agenda for today's session is really in four parts. So, we're going to go over an introduction, which is a national overview of veteran oral health. Next, we're going to touch on some state-specific data for New Jersey. We'd love to have a very active and engaged discussion as to how we could implement solutions for your state and federal activities as well. And then we'll wrap up with some action items and next steps that all of you can take to utilize this data that we'll be presenting today. As I mentioned, this session is being recorded. We ask folks to stay muted. If you're not speaking, if you would like to speak, please do so. Shayla will be monitoring the chat, so if you want to add a comment or come off of mute at any time to engage in discussion, we're happy to facilitate that. But please stay muted otherwise. All of the materials will be available to you after via the AIDPH Academy, and that also includes CEUs. So we'd love to get to know anyone who's here. If you feel comfortable and you're willing and able, please type your name into the chat and we'd love to get to know you. Throughout today's session, we'll be using an audience engagement tool called Slido. So Slido is really for polling, for us to get a temperature check on some of our questions, and also, again, to facilitate engagement throughout. So you can join Slido via slido.com and put in this code for today's event, or you can also scan the QR code with your phone and it'll take you to that website as well. Okay, these are the learning objectives for today. I'm not going to read them out, but I will pause momentarily for you to review. And with that, I'd love to bring you into your first poll, which is what brought you into today's session? Okay, so as you're responding to that in Slido, and Shayla, I'm just bringing up Slido on my side too, so I can post the results. So I'm letting folks respond really quickly while I'm logging in to project those out. Okay. So again, as folks are responding to this, what brought you to today's session? If you haven't already, please let us know. As you're responding, I just want to note we don't have any disclosures for conflicts of interest and would love to introduce who we are and what we do, and also say thank you for our hosts today with the New Jersey Dental Association. So, hi everyone, I am Dr. Annalise Cothran. I am the Executive Director of AIDPH. Appreciate all of you being here today, and also want to introduce my colleague, Shayla Stewart. You'll see her in the chat and also here on your Zoom screen. We'll be facilitating throughout. Our colleague, Christine Coffey, is also here. She's our Director of Communications. And a special thanks to Orville Morales, who is our host today through the New Jersey Dental Association. We are really looking forward to working more closely together with all of you moving forward. Okay, so I think we can go ahead and project the results from the first poll, which I will show us here. What brought you all to this session? So it looks like everything. Our goals here today are to learn, share, and connect and act, which is wonderful. I'm glad that all of you feel really empowered for all of these activities, because don't worry, you will get a chance to do each and every one of them by the end of today's session. So I feel excited that all of you are primed for those activities. And so now we also want to learn, what do you believe are the top priority areas for veteran oral health in your state? So as you think about the priority areas in New Jersey for veterans to improve oral health, to work through advocacy, or to facilitate clinical care, what comes to mind in terms of top priority areas? Okay. So as I'm looking here, this should be a super quick poll. What do you think are the top priorities? So right now I'm seeing policy advocacy. I'm also seeing access to care. And again, please feel free to continue to respond to this poll. But I will say that of every single state, and we're, I think, now at 25, 27, something like that, out of every single state that we've been to, access to care is always the top response. And I think that that's really clear. When we're going to go through our data here today, we'll talk about why folks are so focused on access to care, what the barriers are, and what you can do to relieve or mitigate some of those barriers. One of those would be policy advocacy. So I'm excited to see that pop up in today's conversation as well. Okay. You can keep responding if you haven't responded yet, but we're going to go ahead and move on to the content portion. So, by way of introduction, let's talk a little bit about AIDPH, who we are, what we do, and why we do it. Our mission is to empower communities to advance oral health through research, education, and advocacy. And our veteran oral health portfolio really spans all three of those activation areas. And we're going to share a little bit of our research today, but also educational resources and advocacy resources as it relates to your state and also more broadly. Ultimately, our vision is a justice oriented oral health system where all people, including veterans, have access to affordable, valuable oral health care. So, we do our work predominantly within four core communities of focus. Obviously, one of those is veteran, but that also includes LGBTQIA plus people, people with disabilities, and people living in rural areas. Our veteran work really connects at the intersection of all of our communities of focus. So, as we go through today's discussion, you'll also see that we talk a lot about veterans with disabilities, and we're also going to touch on rurality as it relates to veterans too. And we have some of these data in your state profile that we'll talk about today. Okay. So, why do we do this work? Well, we understand that there's intersectionality in all of our core communities, and sometimes it looks like there's disparate connections between our four core communities. But we like to present this information to show there's a lot of connection and overlap between these communities, and that at the end of the day, all of them have a common experience of being excluded from healthcare systems and really struggling to access care, as we've already talked about, along with addressing barriers to optimal oral health. So that's why we're here today. We also want to give a shout out to our funder, CareQuest Institute for Oral Health. We have been able to achieve these 27 state stops through capacity building funding from CareQuest Institute. We're very excited that they continued to support this work financially. And to give an overview of how we got here, in the summer of 2021, AIDPH launched our first survey. And that was because at the very beginning of 2021, I was approached by our partners at CareQuest and asked a simple question: what do you know about veteran oral health? And I was embarrassed to admit that I really didn't know anything about veteran oral health. And I was embarrassed because at the time, I had never considered an overlap between both my personal and professional perspectives here. I'm the spouse of a veteran who's a Purple Heart recipient. I've been a beneficiary of the military healthcare system for 16 years now. And I never considered what my personal life and personal lived experience, how that could potentially connect to my professional expertise and passion, which is addressing optimal oral health. So, whenever we started this work in 2021, there was no data available. Everything I was able to find on veteran oral health really fit on a piece of paper. And we took it upon ourselves to invest in research first so that it could inform our education and advocacy efforts. So, throughout 2021, we connected with national partners for veteran oral health to include veteran service organizations and published our first white paper that was very foundational to understanding the oral health and well-being of veterans. Since then, we've done a lot of education and advocacy work, and we're going to go over some of those tools and resources that we've been privileged to develop over the past few years. And hopefully, this now contributes to all of your state based advocacy. Okay, so let's start with the national landscape. Sometimes this feels obvious, and sometimes we find that looking at this foundation actually gives us a lot of clarity to be on the same page about what veteran oral health looks like on the federal level and how we can really be activated around these disparities. So, starting with this national overview, again, this could be familiar to some people, but we found that some people, even including veterans, we have data understanding that veterans often don't understand this process. So, this is where we like to start. Doing this work for many years now, we have found repeatedly that the eligibility process remains very confusing. And what veterans can receive or where they can access this care is, again, very challenging to understand. And that's why we like to set the stage here. So here's the key point for you to remember that eligibility for medical and dental care through the VA isn't actually set by the VA itself. It's determined through Congress, and that can be only changed by congressional action. So Congress informs Title 38 of the federal law. It outlines what care can be covered, what care can be allocated, how much it can cost, who qualifies for that care, and ultimately where it can be delivered. So, because of that, any major changes to dental coverage has to come from congressional action, and it's really not just a policy update. So, when we talk about limitations in access to dental care for veterans through the VA, it really all ties back to this federal law and how the VA is allowed to implement care as a result. I do want to point out, though, that it doesn't mean that we can't take action and create change at the local and state level, which is why we're here today to talk about all of these issues with you. And hopefully, you feel activated to make change in your local communities. Currently, most veterans are not eligible for dental care through the VA. So, as you look at this visualization, that top row of people you see represents all 18 million veterans currently living here in the US. So, about half of those, or about 9 million veterans, but we're looking here to the left of the screen, are veterans who have medical care through the VA. So, as you can see, that tiny blue and red portion to the very far left, that actually represents the number of veterans who are eligible for dental care through the VA. And so, what this means in practice is that veterans might go to the VA for a medical appointment. Those 9 million veterans might be walking into the VA for a medical appointment, get treatment, perhaps for a chronic condition, but still leave with an unmet dental need because they are not eligible for dental care. And even among those 1.8 million veterans who are eligible for dental benefits, only a third actually utilize them. So at the end of the day, there are a lot of barriers to accessing care, and we are really left with a deeply inequitable system that is linked back to veteran eligibility, but it also has a strong tie to utilizing the current benefits system. We know that this problem is even worse for veterans living with chronic conditions, and that's where good oral health is especially critical to improving overall health and well being. Veterans with chronic conditions like heart disease and diabetes are especially vulnerable to oral health issues. And really, what's even more concerning is that veterans with these high risk, high cost conditions are more likely to lose all of their permanent teeth. And in fact, we see poorer oral health outcomes for veterans versus non veterans, even if they have seen a dentist in the past year. So, this all means that access alone isn't actually solving the problem, that even when veterans get dental care, they still face worse oral health outcomes. Some of this is probably related to the lack of integrated care because we know these chronic conditions can't be fully addressed without coordination of oral health care. And that's why this issue becomes so frustrating at the end of the day is that the VA is the largest integrated healthcare system in the country. And because of this very high integration in terms of care delivery, we know that they're best positioned to meet these complex needs and to also address these chronic health conditions. But we just explained how the lack of eligibility actually perpetuates this chronic inequity that we're seeing. And ultimately can create major gaps in that in those overall health outcomes. So again, continuing some of our research here, and we'll get to where you can find all of this in just a second. We conducted research in partnership with CareQuest. I think it's been about 2 to 3 years now, but the data have not changed really. So even after controlling for factors like income and education and whether someone lives in a rural area, we still found that veterans with diabetes were about 40% more likely to be edentulous or have lost all of their natural teeth compared to veterans without diabetes. And we know that that is one of the most profound oral health outcomes that can occur as a result of chronic inability to access effective oral health care. Um, we see very similar findings when it comes to diabetes or to heart disease. Sorry, I think I just said heart disease, but I meant diabetes with the last slide. So veterans with heart disease were more likely to be completely edentulous as well, even when controlling for these other factors. And really, what our data reinforces and what we're sort of seeing across the board here is that chronic conditions like heart disease and diabetes, they have a more significant impact on veterans versus non-veterans as a result of the risks that they encounter through their military service. And our data have really reinforced how chronic disease conditions are more prevalent, and they also create more profound, poor oral health outcomes as a result. And this is really the headline here, that with prevention investment, we can save money. So, when dental care is managed as part of an integrated healthcare system, like what the VA could offer if dental care were expanded, there's a pretty clear opportunity here for cost savings, especially and in particular for veterans with chronic disease conditions. And what we're showing here is research that we conducted a few years ago that was based on Cigna Healthcare's algorithm and understanding of the connections between chronic disease conditions and oral health outcomes and basically utilization of dental care. And through that applied algorithm, our research indicated that for every dollar invested in dental care as part of diabetes management, there was a $1 savings in related medical costs. So essentially canceling out the cost of that care. With heart disease, it's even more striking. With every dollar spent on preventive oral health care, it can actually result in a $2 savings for heart disease management. So at this point, dental care would be paying for itself when it comes to these chronic disease conditions. So that's an important context to keep in mind as we look at chronic disease trends in New Jersey and consider what solutions might look like there for your state. As I mentioned, we do have some community highlights here in relation to rural veterans, and we specifically highlight rural veterans in your state profile, knowing that this is a really important area of focus and that people living in rural areas often disproportionately experience poor oral health compared to people living in non-rural areas. So these data points were collected through research from AIDPH and CareQuest, and they come from Burfus, which is a national surveillance system and where we get the majority of our state-based data. So comparing rural veterans to non-rural veterans, they were more likely to rate their dental health as poor. 72% of veterans are seen in private practice and versus a VA dental clinic or an FQHC. And what is particularly concerning is that rural veterans do visit an ED for a dental related emergency more often than urban veterans. And that when you look at these data as a whole, veterans compared to non-veterans in general are more likely to visit the emergency department for an unmet dental need, usually through pain or infection. And this is, again, just a highlight of what we at AIDPH have seen here. This is a quote from a veteran that I actually personally spoke to multiple times trying to get them into care. When we first started this work, we actually received an outpouring of connection from veterans who were really desperate to get dental care. And so I'm presenting some of their feedback here today for this veteran living in Maryland who could not receive or afford care, even though we were able to give them resources connected to the VA dental insurance program, even connect them to local FQHCs. They still could not afford their care. And I just think it's important to read this in their own words, where he said, I haven't been able to see a dentist in 5 years. I simply don't have the money for it. I'm a single father. I live off of 80% disability from the VA. I have halitosis and gave up on my teeth because I know I just can't get oral care. Please help me. I do not qualify for a VA dentist. And one thing this veteran shared with me personally was that they struggled to find employment as a result of feeling self-conscious about their mouth and teeth. And so we understand that these economic burdens that veterans are experiencing because of this pervasive lack of dental care often extends beyond just, these feelings of embarrassment or feelings of not being empowered to address their oral health that really does affect other parts of their life as well. So let's talk a little bit about where you can find this data. We've given an overview of the data and some of our key findings from many reports over the past few years. We want you to know where you can find this data, and we've made it as easy as possible. Everything that we're presenting here today, you can find on thatdentaldata.org, which is essentially a one-stop shop for veteran oral health data, for advocacy resources, for education resources. And we want to point out a few things that you can use in this website as you're going through and evaluating resources or maybe looking to take next steps in your advocacy work. So this is our interactive dashboard where you can find things like cost of care, state-based indicators, rurality in particular, and we have MEPS data from the Medical Expenditure Panel Survey that can help you understand where out-of-pocket costs are also coming for veterans and their oral health. This is an example of one of those screens for rural veterans where again, you can look at whether or not whether or not a rural veteran has refused dental care because they couldn't afford it, whether or not they had extensive out-of-pocket costs that prevented them from being able to effectively dress their care, etc. So again, this is an interactive dashboard. You can feel free to play around with it at thatdentaldata.org and really examine for yourself what these data are and how they could potentially relate to your state. Projecting again, these data really reinforce some of the quotes that we've seen from veterans. So as I shared, this veteran that I spoke with from Maryland had a lot of problems and felt very self-conscious about their oral health. And our data, our quantitative data also reinforce this connection that veterans avoid smiling or feel embarrassed or have even taken days off of work because of the state of their mouth and teeth. And really how these dashboards work, what our goal and hope is to really tell the story, the full story of what veterans are experiencing in this country. So as you're looking through education materials, as you're looking to improve clinical care, and as you're considering advocacy, we really want to give you the full spectrum of tools and data available in that effort. So the data that we pulled from today have come from several publications, all of it that you can find here at AIDPH's website, but you can also find it again on thatdentaldata.org. The information that we're presenting, of course, is limited. This is really designed to be a snapshot here in today's session. But we have lots of information so that we can really create clear and tangible data to facilitate veteran oral health advocacy. So to kick things off, I want to share a little bit about New Jersey and to give you some background on why we're doing this tour. We've developed a set of resources that include research articles, state profiles, and report cards. So if you hover over New Jersey on the interactive map on thatdentaldata.org, you'll find this detailed profile. We're also going to link directly to it in the chat, but you'll know where to find it after today's session. These profiles were created for all 50 states, and we're very excited to say that these profiles that were created in 2023 because of advances in policy through the PACT Act and also potentially through a pilot program that was passed in the Elizabeth Dole Act of 2024. We are now looking to update these profiles next year with the most updated data and support from CareQuest, with support from CareQuest Institute for Oral Health. So for right now, these are the data that we have, and we're really excited to continue updating them in 2026. Okay, so let's get into it. Let's talk about New Jersey veterans. What are the tools, data, and resources that you can look at for veterans in your state? Just pausing to look at the chat to make sure I haven't missed any questions. Okay. Okay. So before we dive into the state specific data, we would love to hear in one word what you think your biggest challenge is for veteran oral health in the state of New Jersey. So if you don't have the link for Slido, you may have joined late. Shayla's going to pop that into the chat really quick so that you can contribute to, in one word, what you think your biggest challenge is for veteran oral health in the state of New Jersey. Okay, I see some folks typing, so I'm going to give everybody a second to think. And one thing I would point out too is, again, we ask these questions in every state because we really like to take a temperature of what every state is thinking and feeling. And a lot of times we see commonalities, no matter where you're living. That access to care is also super important in almost every state. But I'm curious if there's anything specific that we may have missed for the state of New Jersey. So education, access came up again. I think that that makes a lot of sense. We see that reinforced in most states. I'm seeing some conversation too about the political environment, which I think is going to be really challenging in every state. That, understanding stakeholders and how we can engage them effectively and get their investment and buy-in. That certainly is something that is a challenge in every state and is also a challenge at the federal level too. Okay, we have one more vote for access. I know we have 11 participants on the call. We were at 13. I'm sure people are kind of going back and forth. So if you're able to hop into Slido and contribute to this, again, these data are really important for us to understand and look at nationally, the impact of what veteran oral health might look like in your state, but also we want to hear directly from state stakeholders about what's important and what the priorities are for your state. So if you haven't answered yet, there's still time. Okay. So what does the veteran oral health profile look like for New Jersey? To give a little background, we put together these state profiles to really answer the question of what does veteran oral health look like in my state? We were getting a ton of interest in understanding the specifics of veteran oral health. And so if you want to bring up your state profile, we linked it in the chat to follow along, ask questions, think about things, and reflect on them. We'll highlight the most relevant points in this conversation today, but we just don't have all of the answers. And we really look to our state partners to look through the gaps in the current data and identify ways that we can really expand this conversation. So the road tour in and of itself was designed to be about both listening and learning in all parts. We're here to listen and learn from all of you, and hopefully these data can help stimulate that conversation. And your insights ultimately will help improve these profiles. As I mentioned, we're very excited to update them next year. And so part of these conversations help us understand where to prioritize these updates and what data might be available from a community-driven perspective. Okay, so let's get into it. When we open these profiles, the top of it is designed to be a really quick overview. And when you think about potential target stakeholders for these profiles, you may be presenting this profile to someone who knows nothing about veteran oral health. So the goal is to provide a really simple overview that you can use as a conversation starter to understand where nationally the scope is with veteran oral health and what access looks like through the VA. So again, the key point that you should always include as you're considering these profiles based on who you're talking to is that most veterans are not eligible for dental care through the VA. And while we all here might know that information, policymakers, funders, decision makers, that might be completely new to them. I talk to people almost every day who think that veterans get dental care as part of standard care through the VA. So just bringing up that one point is actually really powerful. So whenever you're starting these conversations, I think addressing that gap at the federal level is really important, but also there's activation points for states at the local healthcare within local healthcare systems. And often that federal gap creates a burden on states to help address the lack of dental care. And as we've seen even today, all of you acknowledge that access to care in your state is really a problem. And some of that is due to the fact that we just don't have the access and eligibility that we need at the federal level. So in general, we've shown a map here of where veterans in New Jersey are located, where they're concentrated in terms of counties, and also just some fast facts about where your population of New Jersey veterans are, the proportion of the population of New Jersey, and also again those kind of top counties where they're located. Okay, and so this next section of the profile compares New Jersey to national averages because without that context, it's hard to understand where these numbers are and why we should focus on New Jersey compared to other states. So if you're sharing this, for instance, with a policymaker or a veteran or a program leader, they may not know that if 18% or 17% is high or low. And so this helps you give a comparative context as to what areas that New Jersey is doing very well in terms of veteran oral health, but also opportunities for improvement. So, two things that we focused on with both veterans and specifically looking at working age veterans is that we also understand there's a policy concept or a policy connection for older veterans and older people in general. Which is why we connected some of these data to working age veterans, knowing veterans who don't have coverage potentially through Medicare and who are in the current workforce and may be impacted by the lack of access to oral health care. So here in these blue bars, you'll see where New Jersey compares to these national indicators. And one thing I'll note here is that the sample size was too low for us to pull out state-specific insights on rural veterans. But one thing we're looking to do next year is potentially aggregate those data over several years. So for some of these states where we don't have rural indicators, we're hoping to correct that by improving the sample size in future iterations of these profiles. And then lastly, looking at these state rankings across the four chronic disease conditions that we discussed earlier, we are comparing all 50 states and where essentially you're ranked in individualism, heart disease, diabetes, and insurance. And we ranked them from worst to best. So the lower you are, the worse you're comparing in these indicators. And then lastly, the second page of these profiles includes a grade portion of the profiles. And again, this is designed to be a snapshot for veteran oral health in your state as a conversation starter. And a report card is a really easy way of putting everybody on the same page. We've all received report cards before, so we understand the concept of a report card and how it drives us to make decisions based on where we're currently at within these key indicators for veterans in New Jersey. So one thing to point out here is that New Jersey is really struggling in terms of diabetes. There is a high proportion of veterans in New Jersey who have diabetes, and also that dental visits could certainly be improved. The number of dental visits that are being reported could certainly be improved. So taking a look at where your state is succeeding and exploring maybe why or how you got there within your state and your state healthcare systems and workforce and all of these contributing factors can give a lot of insight to a path forward where you may want to improve or invest in what's working. You can also look at this for other states. So you may have a state that you look at frequently for comparison, and so you can also measure where you might be doing well. And when you bring up other state profiles, either for policy or infrastructure, and make those comparisons, you can kind of look at a similar environment and understand what might be differing or successful in that strategic pursuit. So again, just reinforcing that we have state profiles, but you can also explore other data via that dentaldata.org and this oral health data dashboard. So this dashboard can allow you to quickly gain insights on a few key indicators, allows you to very quickly explore other states, kind of for this heat mapping tool. And it also gives you the opportunity to gather data really quickly and comparable ways to look at data indicators for veterans in other states. And this will also be one of the things that we update next year. So stay tuned. All right. So I know we've presented a lot of information and there's a lot to take in, and we would love to hear from you. We've given you all of this data, but we don't know what we don't know. So, what is one barrier that you know, being in the state of New Jersey, that is very real for veterans in your community, but may not be represented in the data? So, again, as we're thinking through ways that we really want to engage stakeholders in the state of New Jersey, and also understanding ways that we want to improve our data and look for gaps or address gaps, your feedback is really helpful. So, thinking through your lived experience as clinicians, as decision makers, as program administrators, what is a barrier that you see commonly, but we just don't have the data for it? Oh, have we launched the poll, Shayla? Oh, this is in the chat. Thank you. Okay, I was like, that poll doesn't make sense. I didn't even look at my own instructions here. Okay. So let me pause and say you can put this information in the chat. However, if this is something that you want to talk about and just come off of mute, we'd love to hear your voice. If there's a clinical care experience you've had that might be helpful to kind of share out with others. I know that you have a very activated community when it comes to supporting veteran oral health. So what are you seeing here, boots on the ground, in terms of barriers that we just don't see or have not yet captured in the data? Yeah, Mark, go ahead.
At least the experience I've had is veterans don't know where to go.
Mm.
They don't know what availability is out there. The VA resources are extremely limited. Now, as you know, I'm very active in Dental Lifeline Network, and I've had our local congressman refer veterans to me because no one knows where to send the veterans and they don't know themselves. That's one barrier. The second problem is transportation. Many of them don't have a way to get to a local dentist, and the dentist may be scattered with regard to those who are willing to treat patients. But I have seen, at least here in New Jersey, we have 580 dentists on Dental Lifeline Network willing to see vets. In fact, now we prioritize vets through our screening process, but the vets don't know we exist. So I see that as a big problem here in New Jersey.
I think that makes perfect sense. And you know what, Mark? I don't think New Jersey is unique in naming transportation as an issue. We hear that in a lot of states. And it might be because of the fragmented access points that you just described. You know, many veterans are relying on kind of pro bono care and organizations like Dental Lifeline Network doing really great work, but maybe they can't physically get to the care that's being offered to them. So it's about access, but it's also, I'm hearing, some structural barriers related to being able to get into the care and also recruitment for those care opportunities.
Right. I mean, right now we're trying to spend more money on marketing to the patients and also to the dentists to get more dentists involved. The other issue, though, I've noticed with veterans is many of them need prosthetic work, and
Mm.
that costs a lot of money. And it is a pro bono program for us. So we're constantly reaching out to see what we can get from the state to assist us in those efforts. You can only ask a lab to do so many free dentures before they say no. So that's something we're working on here too, is the budgeting. People have enough money to subsidize the laboratory costs for a lot of these veterans, because like I said, most of them need prosthetic work.
Yeah, that makes total sense to me too, especially with so many veterans not being able to receive routine access to care. It means that by the time they get to a dentist, those care needs might be more complex or more profound. And unfortunately, that means that there's a higher out-of-pocket cost for that care. So thanks for raising that, Mark. Orville, I see you're also unmuted. Is there something you want to share?
Yeah. Something that jumps out at me in this report was interesting is the lack of institutional coordination on the needs of veterans. So, case in point, veterans facing diabetes at such a high percentage based on the population. It makes me wonder, and working with local departments of health that are doing programs that are focused on healthy behaviors, but including, language or conversation to target veterans that are also dealing with that issue. And for us, we coming into this new legislative session, we're looking at how health behaviors could impact people's health, and making sure that we are including veterans into that discussion while we are talking about oral health as well, because there is a connection of diabetes and their oral health. So, ensuring that all of the stakeholders that deal with the veteran community, have information around how oral health, addressing oral health issues along with other barriers to healthy behaviors, where we can find some coordination amongst the different stakeholders. So that's what stands out is that institutional block of not working with other groups.
Yeah, I love that you've brought up how there are a lot of stakeholders who really have the ability to make a change or address a need, and that coordination among them could be really important in creating a transformation around some of these outcomes that we see, especially with chronic disease conditions. But I also really appreciate that you've pulled out patient empowerment here, that veterans need more information about how to take care of themselves between dental visits, especially if access is particularly challenging, and really giving them the tools to be successful outside of the dental office.
And it actually just struck me, if I may add another item, are also the spouses of the veterans. There isn't any information or data about the spouses, especially around their oral health, which makes me wonder, while they're serving, they have benefits, but when they're not there anymore, and if your loved one can no longer be a major provider because they depend on disability, what's happening to their oral health as well? How are they taken care of? So that was something that I didn't see in the data, what's going on in that respect. Because essentially, our military families also sacrifice, just like the veterans did. So that's something that I think is a barrier that would really tell that, because then that hits the mental health component of veterans. Because we know with oral health that impacts significantly a person's mental health. So when your family is also struggling with that, it's kind of that struck out to me as well.
Oh, I love that you've pointed that out because, health doesn't happen in a silo with an individual. We're all in community with each other, especially when you're talking about your family. So, as a spouse of a military, as a medically retired veteran, my spouse certainly has access to care through the VA, but myself and my children don't. So I'd love to learn more about that too. You're right. We don't have any data about that. So I think it's a really good call out that if there's a way to evaluate that and understand the impact of maybe siloed care, I think that's a great call to action. Is there anyone else who'd like to step in with a barrier that they see or an experience that might be helpful for us to capture? Okay. Well, if one comes to mind, that's okay. Put it in the chat. We're still going to capture it. And Shayla will be there to help us make sure that if we need to stop and reevaluate in the conversation, that we certainly can. So for now, we'll
If,
hop to the next few pieces. Yeah, go ahead, Orville.
if I can
Sorry.
just throw one more thing, because I would be remiss if I didn't mention it, not to call them out necessarily, but to acknowledge her great work. Assemblywoman Melinda Kane, who's on the call right now, but I do know how busy she is at this moment. So if she's, jumping around different calls, I know this is a recording and she'll watch it later. And we'll definitely follow up with them. But I just want to acknowledge that she's in the room as well, and just grateful that she's taking the time, because she has quite experience in this space. Sorry
Oh,
to call you out,
no,
Assemblywoman.
thank you so much for being here. Is there something you'd like to share, Assemblywoman Kane?
I'm sorry, was I was on another call and I just heard my name and just walked back in. I didn't hear what you had said.
I just was acknowledging your presence as you serving on the military and veteran affairs in the assembly, but I knew exactly how busy you are, and I know that you were probably stepped away. So I just wanted to appreciate you being here as well and having firsthand experience. But I know you're busy. I'm just grateful you're here.
Because God help us if we don't multitask and we just sit and focus on one thing, So thank you so much for acknowledging me.
Yes, we definitely appreciate you being here, and thanks so much for disseminating this out to other stakeholders and decision makers in New Jersey.
Absolutely.
Okay. So let's chat about how to use this data. I know we've talked about what the data are, and we've talked a little bit about some potential conversations we can have as a result of the data, but anybody who knows me knows that I talk a lot about data being useless if we don't know how to use it and we don't know how to apply it. So let's talk a little bit about that as we're wrapping up today. We're going to go over 4 different ways that you can use these data, recognizing that you probably have other ways that you've identified that you can use these state profiles and accompanying reports. One is veteran advocacy. And we're really excited to have some policy advocates right here on the call with us. So this probably feels like a very obvious one that you can use your storytelling, you can use these state snapshots to talk with local elected officials and really share the burden, but also the opportunities for addressing veteran oral health on the state level. Of course, this all filters up to systems change that happens on the federal level, but we really want you to feel empowered for creating solutions that are local and community oriented to the state of New Jersey. We also want to make sure that this is used as an empowerment tool for educating. And Orville really brought that up earlier, how we can think about patient empowerment. And it's harder to advance that forward without knowing the tools and resources available to us to help support that patient empowerment. So having our state dental association really involved and wanting to create a solution helps with getting those resources out to clinicians, to veterans themselves, to social workers, to folks who are really considered as part of the stakeholder process around veteran oral health. And we're happy to support that as you're doing that good work. We also hope that, especially in these initial phases, that these profiles and the associated federal data that we have can help inform strategic decisions. We know that there are gaps in the data, but these help you take the first step to looking at a problem or an intervention more closely and creating those data-informed solutions that could come from internal planning, board discussions, or local efforts as part of that broader sort of equity strategy. Lastly, looking for funding is a great place to go with this. So a lot of times we encourage people to look at your local and state-based funders and tell the story of veteran oral health in the state of New Jersey. Talk about what the need is, talk about how they can be funding solutions that creates direct service care, but also create systemic and policy and advocacy change here within your state. And hopefully these profiles can create benchmarks in the end to say, well, now we've increased it X number of points, or we've decreased these poor oral health outcomes. And hopefully next year, you can create an understanding of where those baseline data have gone from 2023 to 2026. Okay. So in the interest of time, I'd love to learn more about where this feels most relevant. And we're almost done here. So I'm going to look at this poll. So please respond to the poll that we're launching in Slido, but I'd also love to hear just kind of a discussion after you've reacted to the poll. So of the following resources, what would be the most useful in your work? But if you feel called to come off mute and share a little bit more about how you might want to use these in next steps, we'd love to learn that. And if not, that's okay too. You can just respond to the poll.
The first thing that pops into my head, of course, is awareness, especially with people not realizing how few veterans actually have access to dental care. So ensuring that we use the research to share it with media, other stakeholders, just to initiate discussions. I mean, I know there's a lot going on and there's a lot of different communities, and so like our attendance today, I think is an example of like there's so much happening, but we need to be consistent, not consistent, semi-aggressive really in getting this information out there. And even if it's just to build awareness as we build relationships with even more stakeholders that want to get involved and find some solutions here. So that's what stands out to me right now, that's most relevant.
Yeah, I love that. And I agree. I think we all have competing interests. We're all working on our capacity. But what I like that you've hinted at, Orville, is how can we move this into a priority area? And that sounds like by getting people invested, knowing the data, knowing the outcomes, and knowing how to make next steps could help us with that priority.
Annalise, you mentioned it in the very beginning that most people aren't aware of the stats with regard to the lack of care available to veterans. I mean, just as you know, I was shocked when I found out several years ago when we met you folks. So I think having those policy briefings available to utilize when we have discussions with legislators is critical. Because I'll tell you, I've had these discussions with New Jersey legislators, and they were all shocked.
Yeah.
None of them had a clue about the lack of care among veterans. Everyone assumes the VA takes care of it.
Yeah.
But then getting back to educational materials, just getting down to the grassroots level and having local dentists get the information out to local organizations and there's, town governments just to get some marketing out there to let veterans know that there is uh, providers available to take care of them, I think is critical.
Yeah, I couldn't agree more. So I think we need to really do the awareness building. I think we need to do some coalition building and ensure that we have people who are here ready to activate and who are armed with the information to build that stakeholder investment.
Right. I think you've heard me say this. I mean, using DPH's resources and the information you have is very helpful. In fact, Orville and I have a meeting in a couple of weeks with Everyone for Vets and Dental Lifeline Network just to try to coordinate some efforts and then combine that with Give Vets a Smile at the ADA. Because I
Yep.
find that if we worked as a group rather than individual organizations, we'll be much more successful in getting the information out there and getting the vets into the offices for treatment.
Yeah, I couldn't agree more. And I am so appreciative for all of your activation because I think it's really with champions like the New Jersey Dental Association that's really poised to lead this effort that's going to create change and next steps. So I appreciate the activation that you've already created and also recognize that we can still, build from that and learn from other successes. So, in that vein, we just want to highlight three really quick state based policy solutions. And I have another one in our summary report that I'll talk about too. But there are three states that we always highlight when people are looking for state based policies. Because we know that eligibility happens at the federal level, but states really have the ability to look through local solutions as well. One is Florida, who recently appropriated $1 million a year through their state budget to fund nonprofits who are doing direct services. So, through a granting system, one of our partners in Florida now provides direct service care. And there are other nonprofits in Florida who are getting these funds to then to fund their services, and veterans receive that care at no cost to them. So we think that's a really innovative solution. $1 million is a really big difference to veterans, but is often not a big difference in a state budget. So that's where they're starting. They're piloting this and making some evaluations about where they can go next. Oregon took a little bit of a different look at this, and they actually did a Medicaid carve out for eligible veterans. And through this process, they actually look at whether or not veterans are Medicaid eligible, whether or not they're eligible for the VA. So there's this kind of vetting process and connecting them to care if they do have access in either of those two buckets. And if they don't, they're provided free dental care essentially through their safety net solution process and a care system throughout Oregon. So that's a way to address it via the Medicaid program and the existing Medicaid infrastructure. Iowa is another really innovative way of addressing veteran oral health care through non-Medicaid dollars, which is through their veteran trust fund. So their trust fund was established through lottery dollars, and it gives grants to veterans directly that veterans can apply for out-of-pocket costs for all kinds of care. Some of that is oral health care, but it also can cover medical care and other out-of-pocket expenses. And all of this is funded through lottery dollars. So this has been a really innovative way of creating opportunities to cover those out-of-pocket costs. But some states struggle with things like Medicaid or state appropriation budget. And so this connection to lottery dollars has been really effective. And that program's been available now, I think, for almost a decade. One other thing that I'll highlight here, which is not a state policy solution, but it is a funder policy solution, is that our partners, Delta Dental in Idaho, created a pilot program where they're just giving out free dental care coverage for folks who need it the most. And they started this pilot program for veterans. So even insurers are stepping up and offering innovative solutions. And I think that this really shows there's a wide variety of ways that we can create policy to help veterans and see what works most for your environment and your state. So our veteran oral health work in Iowa has been pretty comprehensive over the past several years. And I just want to highlight that we have a whole hub dedicated to this overview of lottery dollars and advocacy, now to the point of where we've created a state advocacy toolkit for policy investment in advocacy in Iowa. And you can find all of that at our Iowa hub on our state. These are some of those strategic recommendations that we've been able to invest in the state of Iowa. And so I want to highlight before we end today's call, and again, happy to take a few questions if we have them. Our call to action is before the next month, we want you to share your state profile with one new person, one new organization who may not have an understanding of veteran oral health in your state, but who have a role in making a change and making it better. So I know that that's one reason why we have this session here today, is to share these details out with people who have an interest in veteran oral health and who probably have a role in creating solutions for it in the state of New Jersey. And hopefully these data promulgate some of those discussions moving forward. Okay, any questions or discussions on this call to action? Or any of our policy solutions that we offered, recognizing we can also talk about that offline after today's session.
I just want to say thank you for the great work that y'all are doing here nationally. For sure, it's giving us something that we can hang on, and ultimately, with evidence-based research here, and then sharing it out with our stakeholders is making our jobs a lot easier at NJDA, for sure, to have partners here. And I can say on our end, I'm definitely going to share it more than one person. For sure, over the next year or two on this particular initiative through the next legislative session, but also just with many people, because this is something that even the layperson should know. One, what's going on with our veterans, but two, how possible it is to make change. When we get involved, we get our voices together, and we move with specific solutions. So just from the NJDA standpoint, thank you for this work.
Absolutely. We're happy to support it and continue this conversation. We think it's really critical to create state-based champions for veteran oral health. So we thank you all for being invested in it as well. And so with that, I just want to have a reminder here that if you want continuing education, we have it available to you through the AIDPH Academy. That will be sent to you via the link in the chat, but it will also be sent via email in case you need that. You can also gather stories via our storytelling form on vetdentaldata.org. If you want to submit that in your state, we're happy to share that back out with you. So anytime we get a story that's relevant to your state, we'd like to compile all of those and give that back to you as local champions. And then lastly, we are compiling all of these states into one report. So we already have some of that available. We'd love for you to look through it, learn from other states, look at their successes and challenges, but your state will also be added to this report. So the work that you're doing will already be disseminated, and we'll capture all of this discussion and put it there. And so with that, I want to thank you all again for being so invested. We look forward to advancing solutions with all of you today, and hope that we can continue partnering together on this really important work. So thank you all and take care.
Thank you very much.
Thank you.
Thank you, everyone. Thank you so much.